Hello everyone, my name is Julia Tao and I am a second year student in Gonzaga's MSN FNP program. This video is to discuss my personal philosophies surrounding healthcare and nursing for my contemporary healthcare environment class this semester. I went into nursing really out of a desire to give back to others and to help those who are not feeling their best. I've been around nursing my whole life, as my mom's been a nurse for 35 years. And when I was in high school and expressed a desire and an interest in nursing, she recommended that I start out by becoming a CNA and seeing if the career was really for me. So I did. At 17, I became a CNA. I got a job working on a progressive cardiac unit at a hospital. And I worked throughout nursing school as a CNA. I graduated from OHSU in 2016, and since then I have been working in a large adult ICU that sees everything from medical, neurological, trauma, surgical ICU cases. Pretty much everything except more invasive cardiac procedures, which go upstairs to our cardiac ICU. So with that experience in mind, patient education has become a huge piece of what I do. And it doesn't mean just the patient, it means their spokesperson or their family member who is with them. A lot of times patients in the ICU are too sick to really comprehend what's going on with their care. So a big piece of what I do is to ask questions, to listen to the patient themselves or their spokesperson, to find out what they truly want for their care. We end up with a lot of patients who are pretty sick baseline, have a lot of comorbidities, who end up in the ICU with an acute process going on, like sepsis, pneumonia, COPD exacerbation, COVID, and they may or they may not know what their ultimate goals of care are. They may have an advanced directive or they may not. So, when they get admitted at 2 o'clock in the morning and the tired doctor or PA asks them, if your heart were to stop, do you want us to restart it? Most people don't really understand what's going on, and they, of course, say yes when it's phrased that way. Maybe not understanding that means CPR, that means intubation, machines keeping them alive if it were to come to that. So a big piece of what I do is listening to my patient, to their families, educating about what's going on with their care, to really find out what their goals for care are. Along with the educational piece, I feel that truthfulness is another key quality that I try to abide by in the ICU, because patients and their families really deserve to know the truth about how sick they are. But there's a way to do that with gentleness and compassion too, which are other qualities I really strive to emulate in my practice as well. When I first started out in nursing, I thought that I would spend the rest of my career as a bedside nurse in the ICU. I love the critical care environment. I thrive on the critical thinking, enjoy being there to support my patients, their families, to advocate for them. However, my experience in the ICU has really led me to want to pursue a degree and become an FNP, because I see a need for better primary care, helping patient manage their multiple comorbidities, to have the discussion regarding goals of care, advanced care planning before they get to a point to where an ICU admission is happening. Perhaps work in palliative care to do further education with patients surrounding what their goals of care would be when they are in the hospital environment. So in summary, in my practice, I really put an emphasis on listening to my patients and being truthful with them surrounding their diagnosis and what's going on with their care. Being kind and compassionate, I feel that can go a long way in the nurse-patient relationship and helping a patient really feel like the care they are receiving is excellent. I feel that education is a huge piece, very important to patient care and helping them understand everything that's going on, and really that everyone deserves excellent healthcare and education. If you want to talk more with me about this, I'm happy to on one-to-one. Thank you for suffering through this video with me. I'm not the best on camera, so thank you for watching.